see a lot in the office is what I would call lumps and bumps on the fingers and the hands and wrists. And most of them are cysts, ganglion cysts, standard cysts. And the second most common thing that I see is a giant cell tumor. And so that's a common thing. It's a benign tumor for the most part. And these things, the vast majority of lumps and bumps are things which can be watched or managed expectantly, meaning that we're not going to do too much about it. Now, obviously, I always give the patient the option. If they want it removed, we can definitely have it removed. Or if it's just too large, I mean, there are just certain ones that are in certain locations that we should just remove and, of course, send to pathology. Now, the different story is if there's any indication on x-ray or otherwise that there's something more going on, meaning possibly an actual malignant tumor, then of course I refer to a musculoskeletal tumor specialist. And that's someone that deals with tumors of the bones and joints. And I do that rarely, but I definitely do have to do that from time to time. So if I'm reassuring you in the office that I do not think that the lump or bump that you have is anything to be concerned about, definitely realize that we see a lot of these things. But if I do suggest that we get additional opinions from a tumor specialist, then definitely that's something we should do, even if it's kind of one of those borderline cases. But for the most part, and I would say upwards of 90%, most of those things are going to be simple cysts or fibrous tumors or giant cell tumors. And so for the most part, we don't have to be too aggressive with treatment of those things.